How to fight sinusitis during pregnancy. Among the symptoms of sinusitis, we can cite pain around the eyes as well as nasal congestion. If we also add the symptoms of pregnancy and limited medication, it can become really uncomfortable. Don't miss out on these tips. Sinusitis is inflammation of the paranasal sinuses. It is an infection located in the hollow of the bones of the nose, where air passes when you breathe. That is why, among its symptoms, we find nasal congestion and pain in the area around the eyes. Sinusitis is particularly annoying during pregnancy. In addition to the annoyances and limitations inherent in pregnancy, a pregnant woman with sinusitis may feel even worse. In this article, we, therefore, offer you 5 tips to fight sinusitis during pregnancy. What is sinusitis? As we stated above, this is inflammation of the paranasal sinuses. It can in turn be brought on by various causes such as allergies, infection, or nasal problems, among others. In general, we differentiate several types of sinusitis. Acute, healing for about 4 weeks. Subacute, when it lasts between 4 and 12 weeks. Chronic, when it lasts beyond 12 weeks, months or even years. Recurrent, if it occurs several times a year. On the other hand, the characteristic symptoms are the pain localized around the eyes and cheeks as well as nasal congestion. There may also be other symptoms, such as cough, fatigue and weakness, fever, runny nose. Diagnosis is made after a medical examination of the nose and face as well as an evaluation of symptoms. Once sinusitis is detected, the doctor may prescribe antibiotics, decongestants, and pain relievers. However, in the case of pregnant women, pharmaceutical treatments are often not possible. Indeed, a pregnant woman should avoid taking medication and limit herself only to the doctor's instructions. Rhinitis of pregnancy. Moreover, we should not confuse sinusitis with rhinitis of pregnancy or gestational. Indeed, while sinusitis consists of inflammation of the bone cavities, paranasal sinuses, rhinitis, it results in inflammation of the nasal mucosa. Therefore, sinusitis and rhinitis are 2 distinct conditions that should not be confused. Likewise, there is a type of rhinitis called rhinitis of pregnancy, or gestational. It usually occurs during pregnancy and goes away after childbirth. Symptoms include nasal congestion, tingling, sneezing, and coughing. Although its causes are unknown, it does not represent any danger for pregnant women or during pregnancy. It is, however, an uncomfortable condition that can even make it difficult to sleep well. This, added to the symptoms specific to pregnancy such as fatigue, headaches, or nausea, can cause real discomfort for the pregnant woman. Home remedies for sinusitis during pregnancy. Since a pregnant woman should never self-medicate and take any medications without medical supervision, it might be worth knowing some natural tips that could help ease the annoying and painful symptoms of sinusitis. In addition, a pregnant woman should avoid ingesting natural herbal remedies, or resorting to alternative medicine. That is why the following tips are absolutely natural and do not endanger the pregnancy. Drink lots of fluids. Treatment of sinusitis is primarily symptomatic. Therefore, one of the main tips is to maintain good hydration, so during pregnancy, it is recommended to drink plenty of water and natural juices. This will allow nasal secretions to flow more easily, relieving congestion. Raising the pillow for sleeping to fight sinusitis during pregnancy. The position during sleep can make you cough more or less. For this, it is advisable to use a pillow so that the head is slightly elevated. This will make breathing easier and the mucus will drain more easily. Thus, the cough and the need to sneeze will decrease. Steam baths to relieve sinusitis during pregnancy. On the one hand, it is possible to use a humidifier during the night to clear the nasal passages. On the other hand, an additional option is to bring the water to a boil and, once removed from the heat, place a towel over your head and lean over it to breathe in the steam. This will open up the passages in the nose and relieve the mucus that has accumulated in the chest. Using a saline solution. To decongest the nasal passages, it is recommended to use a saline solution and perform nose washes. In this sense, drugstore physiological serums are generally natural and can be used without problems during pregnancy. It is also possible to prepare the saline solution at home by mixing 1 teaspoon of iodine-free salt, 5 grams. A pinch of baking soda. 0.5 liters of distilled, filtered or boiled water. Its application actually relieves congestion. Fight sinusitis during pregnancy. Put on nasal strips to avoid discomfort during sinusitis. You can also use nasal strips. Indeed, they help to open the nasal passages, thus allowing better breathing and, consequently, to reduce the congestion. In addition, you can use them at night so that decongestion is effective and you can rest. Finally, in addition to the tips mentioned in this article for relieving nasal congestion, remember that during pregnancy you must strictly follow the recommendations of your doctor. Only he can determine if and which medications you can take. On the other hand, avoid alternative herbal remedies whose components can sometimes be harmful to pregnancy. Thank you for watching. You can watch more videos by clicking the links in the description. If you like this video, give it a thumbs up and share it with your friends.